So welcome to Transforming Healthcare Through the Power of Listening and Discovering the Joie de Vivre. I am very happy that you could join us today. I've been waiting to have this conversation for about 6 months. It started when we had a regional ILA event and Dr. Gabriel Serra came to New Jersey to speak with some of us East Coasters, and it was such a rich conversation that we wanted to bring it to ILA and share it with a wider, more international and diverse audience. In the process of doing so, Deborah Worthington said, we have a new ILA member from the Netherlands also working in oncology and listening, and I think you should reach out to her. It would make a great panel. And so with a little trepidation, because I don't know her and I've never met her and there's an ocean between us, Corinne Janssen
Yeah.
had a Skype call that was immediately clear that she belonged in this panel, the work she's doing, the quality of her listening, and so thus began the conversation that we are about to invite you to be part of. This conversation is going to be in 3 parts. The first part will be a facilitated interview with Corinne, the second part with Gabe, and the third part with all of you. And so as you listen, please be thinking about questions that you'd like to bring forward, things that you'd like to discuss, and we'll go from there, okay? So, Corinne, I haven't really given any introduction of titles and background, so I want you guys to know that in addition to being an extraordinary Skype listener, she happens to be the owner of a company called JoConnect that is a consulting company that listens, analyzes, and advises, that she has the distinction of also having the title of Chief Listening Officer at Radboud University Medical Center, which is one of the largest hospitals in the Netherlands. She is also a guest lecturer for third-year medical students and nurses, teaching them to listen. And her work has been acknowledged, and in 12, she received the Hofstede Award for her work being conducted in listening at the hospital. She has been a liaison and a speaker at TEDx Maastricht and also TEDx Nijmegen. Nijmegen. I'm not going to speak Dutch by the end of this. And so it's with great pleasure that she will that I get to be part of her sharing this interview with you. Right? So I know that if we don't cover this right away, people are going to be wondering, what exactly is a Chief Listening Officer, and how do you get to become one?
Yeah. Well, a Chief Listening Officer, as I'm a Chief Listening Officer, is listening to patients, caregivers, and doctors. And mostly I listen to people with an oncology disease, people with Alzheimer, and people who are dying. And I try to listen to them and especially try to find out their needs, their wishes, their quality of life, their questions. And after our conversation, I try to get the highlights and get back to the unit or the department or the board of the healthcare system, and I try to change policy so we can really get a better quality system for patients, get innovations patients need, all from quality of life, being really a person and not only a patient.
Okay, we will do more on this.
Okay.
We will turn it over to you guys in a moment, but first I'd like to introduce you to Dr. Gabriel Serra, who has many identities. He is the Executive Director of Patient Service Initiatives at CUNY. He is the Medical Director of the Infusion Suite at St. Luke's Roosevelt Hospital Center. He is also an Assistant Clinical Professor of Medicine at the College of Physicians, Surgeons at Columbia University in New York. His work has been featured on CBS News. He has many accolades, many awards, but most importantly, he also happens to be my mother's oncologist. I had the pleasure of meeting him in what I thought was a orchestrated 10-minute conversation, which turned into a 2-hour-plus meeting, and it became clear that he was a very special person. And so today I hope you'll get to know both the doctor and the person and the listener. All right. So Gabe, when did you first realize that listening was an important part of your medical practice?
I realized that listening, that I thought I knew what listening meant. I realized that I didn't understand what listening meant. I thought that listening used to be for me, I'm discussing with you, I'll talk, then when it's your turn, I will just stop talking and listen to you carefully, and then answer you back. And I realized through some training that that kind of listening, which I was very good at, I could shut up for half hour, listen to you, or 20 minutes. I'm able to do that and control myself. Actually, I was not listening to you. I would listen to you through my mind, using every word you say, so I can argue back and use your own word to confirm my thinking. So I was interested in proving my point. I was not interested in really knowing your point except to enforce mine. And when I realized this, I realized that that was not at all listening. And that was actually removing from me the opportunity to discover really who you are and what you are saying. So when I saw that, I realized what I was doing, and I started to shift my way of listening, which is now truly stop my mind from thinking and be with you, and be with your feelings, and really understand why you are thinking differently than I do. And that's really became an amazing power to have, to now add the two powers of the two people talking or more. So when I realized this, I realized this at home. I stay with my wife, who's here today, and with other friends around me. And then I started to realize that, well, I should do this at the office with my patients. And when I started doing this, it shifted totally my experience with my patients, because suddenly my patients started to talk much more. I mean, I always listened to them, but now they were talking much more. They were giving me so many more clues. I was discovering who they really were, and they were giving me all the elements to be a good clinician. So I would say that, I always say this to my student, I get much more information from my patients when I listen to them than 50 CAT scans and 50 blood tests. And it's smarter, faster, cheaper, and much more humane. So, and ever since, actually, as all of you are listeners here, it's like going to the gym. The more you do it, and the more you realize how amazing it is, and it becomes a part of your automatic way of being. And it's really delicious.
So how has been listening in this way affected your experience and your patient's experience of power and control in the doctor-patient relationship?
Yeah, so I would speak about the cancer patient in particular, but it's true for any specialty. But I would say cancer has one thing, which is it puts the patient in front of his mortality. Even with, I mean, patients who come with a small skin cancer that is curable 100% are worried of dying from this cancer. While the statistics show that you don't die from it, they still, immediately the C means death. So oncology really exposes you to the extreme fears and feeling of patients. And what I say in these situations, like in a war situation, there are no more masks. You can't keep the mask on and hide behind it. So everybody is kind of naked. And that patient comes to you, especially the first visit, after, just imagine the normal person who has a little stomach pain, get an endoscopy, and now he found out that he has a gastric cancer. And it's instant, you know, your life is totally, the table turned on you. And by the time this patient is diagnosed and the time he comes to the oncologist, he's seen several radiology divisions. We had a CAT scan, an MRI, and this biopsy, waiting for this result, seeing another specialist, going for a test for, they arrive to you wiped out, wiped out. That first consultation, they arrive to you having not slept at all. They wonder who is going to be this guy. I'm going to have again to disrobe, and how do I know whether he knows what he's talking about? Is he going to be the right person for me? I mean, all these things in their mind, they arrive completely gone. And the image, I would say, is that the guy with the white coat is here. He's a little god. Yeah. And the other guy is down here, shattered. Whether he is a powerful army general or a doorman or anything, we are all the same in front of that. And it starts with a very unfair relationship. I mean, if I speak like Arabic now to all of you, who will understand? Nobody. So it's very unfair that I speak Arabic today, all right? But this is the doctor, this is the patient, and that patient can't talk to you this way. It's impossible. So you don't see that if you are not listening. And I didn't see it at the beginning. Now that I am improving, I'm seeing this. And I realize that I have to come down and level with my patient so they feel that I'm like another guy.
Tell us some of the things that you do to bring yourself to meet your patients where they are.
So I do one thing. I'll tell you, like, I'm sure that you've gone to doctor's offices, and in the doctor's waiting room, they make you fill up all these questionnaires about your whole history and your drugs and then this and your surgeries, and which saves time for the doctor, so he doesn't have to ask you this question. And I can't stand that. I hate it, actually. Because, I find that when I ask those questions personally, which is going to take me 20 more minutes in my consultation, I am, in the meantime, playing around, trying to connect with my patient. So what did your father die from? Where do you live? What's your job? All these things get me to discover the person before even the disease. And it's always the case, while you are asking those silly questions, supposedly, you connect. And you crack a joke here, or you make a comment on this neighborhood or in that town, or you get, you establish a connection outside of the medical world. And that's the white coat guy is now down here playing around at the same level, and the level doesn't exist anymore. It disappears, no more level, and you feel equal. And I think this is embracing the patient, and that's helps the patients really open up.
So how do you tell when your patients are actually listening to you? When they're open enough and able to be there?
So for them to listen to me, first I have to listen to them, number one. And I do all what I can to have them speak up. Not everybody speaks up. Not everybody is eloquent. Not everybody is courageous. Many are timid. Many are exhausted. So you do your best to get them to talk about something or say something so they feel that you are listening to them. But then, as I'm talking to them, I mean, the physical examination in medicine starts from the second the patient walk to your room. As a matter of fact, there are some diagnoses you make by just seeing how they walk when they walk into your room. You can say, oh, that's what it is. This is Parkinson. This is what. If you don't look at this, you'll miss a lot. So the body language of the patient is critical. So you are looking at that patient with a very wide ear, listening to their body language. And you can see, I mean, now I know that you're listening to me, obviously. Right? If you were not, it would be very obvious. So I constantly monitor how my words are received. And once in a while, I will ask questions. And you have the very common situation. I will have a couple where the wife knows everything, the husband is a sick patient, and he doesn't want to hear about it. And he doesn't want to talk about it. That's very common. Very common. And you immediately see it. If you were watching them, you know that. And you see the interaction. You see the wife saying, every time he answers the question, he does that. You know that he doesn't answer your question. He doesn't. So when I see that, after my usual game to go down and then level off, I say, well, listen, I'm going to now explain to you what you have. It's very complicated. I'm not always good about it. I'm going to do my best for you. And at the end, I'm going to test whether I did a good job. I say, you're going to explain to me what I said. If you don't, it means that I didn't do a good job. At the beginning, I was not as wise, maybe, and I would say, like, I'm going to test you out to see whether you were listening, you know. And there was a little difference with that. When I say that, I'm putting this guy at test, and I'm making him stay under defense. Now I'm saying, no, listen, if it doesn't work, I was the bad guy. You are not the bad guy. I didn't do a good job. When you do that, it's amazing because that person now, they want to make you feel like, no, you're good. So they become very attentive.
Yeah.
I would say it almost always worked to play this game. And so then I really, when I see that they were not listening or didn't want to listen, I do make them repeat, and then I go over it again because it's so complicated to understand what I say.
And it's all happening within the context of intense emotion. And you mentioned that oftentimes people will come with other family members. So I'm wondering, how do you help your patients and their caregivers listen to each other and to you in these highly emotionally charged settings?
I think it's important in this situation to pick who runs the show in that group in front of you. Like you have the husband who's the patient, the mother, and the two daughters, and they are the three of them upset at him because he's been smoking his life, and now he has lung cancer, and he drinks, and all these things that the problem is that when you have a cancer or any drama, all the bag of stuff that we have comes out, all right? And now you start to say, you did this, you did that. It's terrible. The poor guy is already facing a cancer. Now you are upset at him for all these things. So obviously, he was totally disempowered. The family sometimes puts him even further down or her further down. And what I want to do at that moment is I want him to stand up and stand behind him and then tell the family he runs the show. He is the patient. That's his life. That's his cancer. What I want you to do is to back him up. I want you to commit to stand behind him. I don't want you to start playing like, you did this and you did that. And you have to take a stand as a doctor. I mean, I feel it's a very fine line between being intrusive, like, it's our family. What are you doing with our family? I mean, I can see somebody saying this to me. I'm very aware of that, and I play with it so it doesn't come out this way. I have no recipe about how I do it, but I feel it right here, and I try to play with it this way. And by making that patient responsible for his consultation, for listening to what I'm talking about, for the decision he wants to make, and for making him be the one who decides, you reestablish the balance in the family. And I would sometimes interrupt the family when they answer. Like, this is very common. I ask the patient the question, they answer. Say, who is the patient? Oh, I'm sorry, doctor. I said, listen, I want to hear his story. I will listen to you later on, but he is today the patient. So I have some time to say, step back a little bit, and you have some time also to make the family member always meaning well. I mean, nobody means bad in this game. They mean very well, but they can't hold their emotion. And I frequently have a situation where the patient is talking, he has a bad disease, we know he's not going to survive, and the wife or the daughter or the friend, you're going to make it, you're going to make it. They say this to him. And I don't like that, because you are asking that patient to do something he cannot do. You're putting him in a spot of, you're disempowering him up front because you're telling him you're going to do something he cannot do. So I say, no, this is not true. He has a disease that we can hopefully help, but we cannot cure. So it's not right to say that, because it's not true. Now, I use different words depending on the patient's culture, style, all of that. But I want to make sure from day one, everything is clarified. Yeah. So I want to reset everything where it belongs. And by doing that, but it's not only a one-time deal. You have to keep watching this at every single visit till you find that the family, each one now has found his role. The other thing is that you have a lot of time where patients' family come in and ask you a question, what do you think he has? How much on? I say, whatever I am telling you, he knows, and whatever I will tell you, he will know, or she will know. I want to make sure they don't have one moment when I will say something to a member and not to the other. And I try to keep them always on the same page. That's very, very, very important, very important. Although you create walls in the family.
So I just want to come back to something you were saying before. I think that dynamic that you were describing when a family member is sort of cheerleading almost for their sick family member, you described once to me as hero syndrome. Is this the words that you sometimes
Exactly.
use? Okay. I want to play with language. I want to talk to you. I know that you're such an astute listener that you understand the role that language plays. Talk to me about the phrase fighting cancer.
Fighting cancer. Yeah.
What's the phrase? Fighting cancer.
Fighting cancer.
Okay.
Yeah, it's, we have the theme of fighting is so much in our life more than ever now. If you listen to the news, we're fighting terrorism all the time. We're fighting corruption all the time. We're fighting the economy, the inflation. We're fighting all the time. So the word fighting, while I would say I'm a fighter, no question about it. And I could be a tough fighter. I think that we have to decide what kind of battles we want to do and what are the achievements with every battle. And when we say fighting cancer, it looks like you're going to fight some enemy and you're going to shoot them and that's it. It's way bigger than that. Way bigger. And we have not won the fight against cancer, and I don't think it exists to win the fight against it. I think we will win the fight against ourselves to know how to cope with cancer. And I think this is the fight I want to have. I want to have the fight where I'm going to be, hopefully I think I know my job, being an oncologist, I'm going to be your coach to help you live with your cancer or get cured if it's a curable cancer, or die powerfully and beautifully, as you mentioned, if you're going to die. And this is the real fight. The goal of that fight will shift from every patient to every patient, and in the same patient from week to week. So that fighting cancer thing, which sounds beautiful, is very misleading and is part of what the hero syndrome is, if you want to talk about it now or later.
No, please.
Okay. So there is one, this is my own idea to say the hero syndrome. So I'm going to ask you a question. The doctor is here, the patient is here, the family is here. Who is the hero in the room?
I don't know.
Okay, you don't know. Anybody? The patient is the hero. Yeah. Exactly. The patient is the hero. Now, did this patient decide to be a hero?
No.
He never thought of being a hero. The cheerleaders made him a hero that he never asked to be a hero. And they never mentioned the word hero either. Because maybe if I tell you, you're going to be my hero, you say, I don't want that job. But I treated you like a hero without even asking you permission whether you agree that I consider you a hero. And because it's unsaid and it's so present but so subtle, it grows. It grows from that first day when they say, you're going to beat it, Dad, to the last day when Dad is dying. He's still the hero. Now the problem is that from that first second when he was told he's a hero without ever saying the word hero, he now feels that he has to be a hero. Because his family is suffering so much from seeing him sick, he can't disappoint them. So throughout his illness, he's going to complain less and less. He's going to show strength that he doesn't have, which is going to exhaust him more and more, because he has to continue being a hero so he doesn't deceive the cheerleaders. So that's kind of livable and okay. When it becomes absolutely, really a disaster for the patient is at the end. At the end, when the patient is clearly dying, and I'm sure that whomever has seen a dying patient, I'm sure, Corinne, you've seen several like that, some of them hang on. They hang on. You wonder how they can live another 5 days while they were dying the first day. And I believe they can live a few more days with their own will, but they are suffering 5 more days. And one of the problem with the hero syndrome is that that patient who knew he was going to die or she was going to die, having now the job of being the hero, is not allowed to die. And every one of us needs the permission to die. From our family, from our doctor, from our priest or rabbi or whomever spiritual leader. We need to be told, that's okay, you're fine, we're fine with it. But if we don't say that, that patient is going to fight. And that's absolute torture for them. And it's important to see that hero thing because it's so subtle. And it's important to stop it up front. So the family, I will share, I have many stories I could tell you. I could take the whole evening of hero stories. But I will say one that is very striking. This patient of mine comes in, new patient of mine, a 70-year-old patient with breast cancer and had stage 4 breast cancer. Doing all right. I started on treatment. And 2 weeks later, a young woman comes to see me with a stage 4 lung cancer. It was her daughter. So now I have a mother with breast cancer and a daughter with lung cancer. Breast is a much nicer disease than lung. We have many more drugs to treat them. They can live much longer. Lung is a terrible disease. I'm treating both of them, both do very well. But none of them is curable, obviously. So the daughter does great. She's an amazing social worker, beautiful, nice. And they know the truth, both of them. I tell my patients the truth from day one. She does very well. She has a year without any chemo, feeling well, which is unusual. And then she comes back with a very big relapse. In a few days, she can hardly breathe. I admit her to the hospital. Her lungs loaded with cancer, not responding to any treatment, which is the worst way to die. This air hunger is really tough. And the mother is doing all right. The mother had lost her father, her husband, and her son to pancreatic cancer. She was left with that daughter and herself. So just imagine what she was living. And I was leaving the hospital that day. It happened, I was on the floor late evening, and the mother, Elizabeth, comes over. She knows her daughter is dying. I never hide anything from them. She looks at me, said, Dr. Sarah, how's my baby? Obviously, when she asked me how's my baby, she's hoping that I'm going to say she's better. That's what she wants to hear. Now, the daughter, Barbara, should have died like 5 or 6 days earlier. She was hanging on. I would walk in the room, and my heart was broken because she was suffering. And hanging on, not letting go. And this is where the listening makes miracle. Now, I didn't think about listening, but I think I was listening naturally with her. And I immediately saw an opening. I had just heard Barbara, and aching. And I see the mother. And I said, I immediately saw, I said, that's it. I have one little crack. I need to use that crack. So I called, I said, Elizabeth, let's talk. I brought her in the room. I said, I have a deal for you. Said, what? Said, Barbara is dying. She said, yes, I know. Said, she's dying imminently. But she doesn't want to abandon you. She knows what you went through. And she's hanging on because she doesn't want to let you go. Let go and then abandon you, sorry. And I think the biggest gift you can give her is to set her free. The minute I said that, she was this crying, destroyed, sad. But she's a strong woman. She went through already 2 deaths in her family. she suddenly, like, I felt that kind of, you injected strength in her. And she gave me a smile and said, thank you, Dr. Sarah. I think I know what I'm going to do. Barbara died the next day. So this is the hero that was set free, that you no longer need to prove anything. But if she had not done that, Barbara would have died many days later and would have suffered much more. And they would not have had that closure where she told her, baby, you can go.
So it's heavy. And I know that this kind of listening is incredibly powerful at end of life. But I've also seen you work miracles with your attentiveness to the power of attention and how your understanding of how people's attention and focus matters in the quality of their life. And I'm hoping you'll just share a little bit about some of the innovative programs that you have brought to the infusion floor that involve what you do with people's attention and how you offer them opportunities to place it elsewhere.
Okay. So, it's been a dream I had for many years, and eventually the dream came through, which is little things that can make a big difference in patient's life. The patient who comes with cancer, comes to the chemotherapy suite, are sitting there for hours, basically. Their hand tied, sometimes side effects, sometimes vomiting, listening to the ding-ding of all the machines. I mean, it's really not fun to be in a chemo suite, obviously. And what we can do to transform that. So, to make a very long story short, we have a program that I was able to get through funding from several generous donors, where we have music therapy, we have art for our patients, we have pet therapy, we have massage therapy, we have actually a travel program, and we have a makeup program. And recently we started a writing workshop. And we have more programs that hopefully I can fund in the future. And that has really been amazing because the patient comes to the unit and they are greeted by either an artist who sits down and plays with them. I mean, the typical scenario, I had this patient who was starting her first cycle of chemotherapy. Adorable, but very anxious, very tensed up. She was with her husband who was tensed up. Her sister, I mean, you could feel, the electricity in the room coming for her first chemo. I mean, it's such a frightening thing. You're going to get all these poisons for the first time. You don't know what it does to you. And you heard all these horrible stories. And I could feel it, of course. I called the artist and said, please, the minute they sit down, bring all your weapons and sit down with them. And a half hour later, it made my day. I walk in, the husband, the sister, and the patient are having a good, they're laughing. They were all one was doing a bracelet, one was doing a necklace, one was painting, and they were having fun. And they spent the whole session of chemo doing things like that. The musicians is another dimension. I mean, the music therapists are psychotherapists who use music for their psychotherapy, and it's another incredible gift for the patients. The pet therapy, I know that Carol knows all these things. I'm sure you've seen pet therapy. I mean, dogs who come to the unit and the patients pet them. Now, beside the patients who really get a lot of benefit from this, because it's not a distraction. It's, of course, fun. But I think it's connection at the human level. They're not patient 16 getting BP16 or that, whatever. It is Joanne or Carol or whatever. And then it becomes like this fun experience of people who love you, care about you, and then you are very special. Oh, let's finish the project from last time. They come. We have patients who requested to stay after the chemo was over to finish their project. At the beginning, when I started the program, I didn't have enough money. We had the artists coming only one day. And that day was jammed. Everybody wanted to come on that day because the artists were there. Now we have it for 5 days. We opened it to the floor now, and on the floor, the inpatient suite, it's unbelievable. I mean, I could have showed you a picture, but maybe at another meeting. The floor is decorated by the patients. There was one guy who decorated the whole floor for Christmas. And that same patient who gets chemo every 4 weeks for 5 days in the hospital, very sick guy, but an amazing guy, he heard about one of the patients who was stuck to be in the hospital at Christmas time. And she was missing her Christmas tree. He made a Christmas tree with paper and brought her to a room. I mean, just think about the dynamic of the guy who, instead of sitting down, feeling a victim and being sorry for himself, he's finding an inspiration in that old lady, and that's what he was thinking about during that day. I mean, this guy, I could never find him in his room, by the way. He was constantly in the lounge with the artist creating stuff. I couldn't examine him. He was so busy. So this is the kind of things that makes people feel powerful, loved, and the last thing I would say is that beside the patients, the staff is transformed, totally.
I was hoping you would talk about that. Would you
Totally
tell a little bit
transformed
about this?
by the experience of the music, of the art, of the pets, of the travel. The travel, by the way, you know, the travel program is that I have actually a program where we have a raffle every 2 months. We do it in the infusion suite. Depending on the time, we will sing a song with the patients and the musicians while they're getting chemo. And then we do the raffle. And the first prize is usually a cruise. And there are 2 second and third prize, which are a weekend in the bed and breakfast. And if you go on our website, you'll see all the testimony from these patients is incredible. So even the travel programs, the goal of it is to dream. I mean, who's traveling sometime this summer? Who? Okay. So what I always say that is I bet that the moment you bought the ticket, you were already flying. Period. I mean, that's it. I mean, like, this trip is in your head from the second you travel. So the patients who fill up the raffle paper start dreaming from that moment. Whether they win or not, they start looking at something. So they have 6 months of terrible chemo. They're thinking, well, maybe I'll travel. And it creates a total new vision for them during that treatment. The last patient I had who won the weekend was a little old French lady, very sweet, a professor, actually, her and her husband. And she was coming for her first chemo. And they won a weekend in Lenox, Massachusetts. And she was very anxious. She told me, Dr. Sarah, the cancer made me win this trip. You hear that, and I mean, you imagine how great I feel as a doctor on this unit when a patient tells me that. So these are little pearls, I can tell you, but I can talk for 3 hours about this.
Yeah, and so I'm going to give us a chance to talk together, to have your questions come forward to things that you maybe want to.
Yeah, last year they found something in my breast. It was a positive tumor, but it was 6.5 centimeters, we call it in Dutch.
Millimeter.
No,
Centimeter.
centimeter. Yeah, it was very big. So I was really shocked because of the size. And I entered the room of the doctor, and the doctor says, well, Corinne, you're empowered. What are you going to do? That was my look. I don't know. Did you look on the internet? No. Yeah. No. Do you want to operate it, or do you? I was shocked. And they were surprised because they know me from the hospital, and they know that I'm really empowered and training other people to be empowered. But on that moment, I was the patient, and I lost all my trust. I lost all my trust. I looked to my partner and I said, oh my. And I said, I don't know. I don't know what to do. Tell me what to do. And they said, we don't tell you. It's your decision. So I went back home, and I had a lot of fear and stress. And I didn't go to the internet. I didn't go to Google because Dr. Google don't know my size of tumor, don't know my situation. But for over 2 weeks, I was able to create questions. And one of my questions was, I'm living nearby Antwerpen, why do they move that immediately for 6.5 millimeter? And why do you ask me what to do with 6.5 centimeter? Well, I tried and I decided to accept my tumor. It was a positive tumor, so I had no reason to treatment right now.
I'm just going to
you
clarify,
say
by
positive.
positive you mean it was not
Not a cancer.
Not a bad cancer, yeah, okay, sorry, yeah, that's my problem with English. I decided to embrace, do you call it embrace?
embrace.
I embrace my tumor. I got a picture of it. It's a very huge one, it's 6.5 centimeter, 3.5 centimeter on that side. I have to go back again in August. And I can tell you, I'm still not empowered. But I accepted it on my own way. I tried to feel what was needed for me, and I decided, well, it's for me. And I decided, well, it's in my body. Well, I have to accept it. And I told my doctor, I wrote an email, I'm not Corrine as a chief listening officer when I visit you now. I'm a patient and I'm not empowered and I have a lot of questions and a lot of fear. And that is really amazing to notice, because when I noticed it on my own, I realized how people must feel when they are going to a doctor and don't know what to ask.
I will label what you had the VIP syndrome. And as doctors, we have to be very present to that. That's a very dangerous syndrome. If I get in my office a street person or a professor or a head of state, and I happen to have all of these people once in a lifetime in my office, I have to treat them exactly the same way. Exactly the same way. Once I play the VIP game, I will over or under treat them.
Yeah, that's right.
And I do the same when my friends are my patients. I just completely forget the friendship, except for the warmth of the relationship, and I treat them exactly the same. And I give my opinion.
Yeah.
You should change doctor.
Yeah.
All right?
I
An
changed hospital.
oncologist, I'm very sorry, but I will claim that any doctor in any specialty who sees you coming in, nobody goes for fun to the doctor. Who goes for fun? Nobody. You go for a small problem, a big problem, but you're always worried how bad it's going to be. I expect that any doctor, and I won't negotiate on this opinion ever, no matter how deadly your diagnosis is or small, that doctor should be capable of getting you come to his office and walk out feeling better. Even if he told you you're going to die in 5 days, that doctor either will take a stand for you and will be responsible for your life and for your care and for his decisions, and you will feel that, you know what, I'm in good hands.
Yeah.
And you walk out feeling supported and taken care of. That story of dumping on the patient the decision is a story of being a coward, and I don't mind being quoted for this in front of any doctor, and I will defend my opinion, and I prove to them this is true. You cannot be a coward as a doctor. You have to have courage as a doctor. You have to say to the patient, if they have choices, I'm going to explain to you your choices, A, B, and C.
Yeah.
I feel C is better for you, but if you prefer B, I think it's all right too. But I'm not going to tell you, you have A, B, or C, and go.
Yeah, that's right.
Internet, from the very first meeting, I tell my patients, the last thing I want you not to do is to Google stuff. And I'm telling you from now, if you bring me stuff from the internet, I will have no opinion. Last time somebody brought me,
Yeah.
I said, do you remember what I said at the first meeting? So I'm not going to even bother reading your Google stuff. Because if you want second opinion, go to another doctor, not to Google. And that's it. And you have to be clear. And when you are clear, the patients feel safe.
And I want to be clear that you are very receptive to people having second opinions, just not from Google.
Absolutely.
Okay.
From an expert.
Dr. Google is no doctor.
How about some other questions? What else is on your mind? Phenomenon.
Yeah. So yes.
You know, I had a crisis recently. You were out of the country. I was out of the state. And I needed some support from my medical records back in New York. I was in Florida. He was in Lebanon, I guess. So we called the hospital, and I get a doctor on call. And he answers the phone, or he calls me back, and he also has a foreign sound.
He's Egyptian.
Egyptian, but I'm not good enough to tell, but I know it's a foreign flavor. So I have to listen more carefully because I'm not great at that, and I'm slightly hard of hearing. And I tell him my situation, and this man immediately comes out and goes to where he has to go, gets the records he has to get, faxes them within a half an hour so that they reach the hospital that I'm in. 1, 2, 3, just like that. Gives me his cell phone number because he's leaving the hospital. It's the end of the day. He's going home. Call me if you have a problem. What doctor has ever told me to call him when he's out of the office? And then, when we finally deal with the whole problem, everything, we're on our way home by car back to New York, calls me when I'm on the road to see how I'm doing. A week later, in my house, I've forgotten who he is. I get a call. Boy, did he ever learn from you. I thought he was your clone. I mean, it was absolutely astonishing. So my feeling is that not only is this man spectacular from my perspective, but he's mentoring and creating other spectacular people, for which I'm very grateful.
Let me tell a little story. That the first time we went in to see you, Carol had already seen about 15,000 doctors in New York for all her different things. She came in with a lot of anxiety. We knew she had a problem. And Dr. Sarah, within, I'd say, 15 or 20 minutes, had figured her out. Exactly.
At my number.
Most of Carol's problem is anxiety about not knowing what's going to happen, how much it's going to hurt, because she can't tolerate
Don't give away the
any
whole
pain.
store. Don't tell them.
But one of the tests was going to be his spinal tap.
What's it,
Bone marrow.
spinal tap?
Bone
What is it, a
Bone marrow, bone
That's what I
marrow,
couldn't
right,
remember.
right. Now, Carol immediately says, I'll call and make an appointment.
Put it off.
She would put it off 10 days of total agony, thinking of what it is and how much it's going to hurt her. Dr. says, no, we'll do it right now. And they did. And
He actually said, because he does not mandate, so I want you to get the nuance here. He said, well, you could do that. He says, you could do that. We'll make an appointment. He says, but this lovely woman, my colleague, who's been with me throughout our discussion here, is an expert. She happens to be one of the best people in doing a bone marrow. Unfortunately, she's not going to be here next week. She's due in Boston for a conference. Okay? She's in Boston for a conference. So I think it would be a great idea if you just do it now. And the next thing I knew, I was doing it.
I just want to tell you, Carol is just fine right now. And but she had 16 infusions over 2 years. And I tell you that we went there not with anxiety. We looked forward to it. It was fun, actually.
Sounds
We would
crazy.
see Dr. Sarah for on each occasion. We'd have some laughs. She'd go do her thing. She'd
I'd
pet
play
the
with the
dog.
dog.
She wanted to take that dog home. She'd make a greeting card.
If you knew me better and understood how terrified I am of medical things, you would understand
yeah.
what an incredible and unbelievable situation.
And Carol did some professional singing, and she'd sing with the music. It was just, it couldn't be better for not such a good situation.
How about the fact that I play facilitator for a moment? Our program time is officially over. We are here for as long as you wish to be speaking and listening. If there are more questions, you're welcome to ask them, or comments or observations or stories that you would like to share with us. We have a small vision. It's not very ambitious. We want to transform healthcare worldwide. And we really want you to be part of doing that with us. We're hoping that we may be able to pull a conference, a regional listening conference together in Europe sometime in the next couple of years, next year or the year after. We're going to retire to the mezzanine level where there are those extra seats, and some of us will continue the conversation about this, and can we begin to engage a broader international audience to look at systemic transformation, person-to-person transformation, and how listening plays a role in creating some of the positive outcomes of living and dying and healing and curing and the things in between. So mezzanine level, in a few moments, we'll make room for a business meeting.